Is Ritalin a good idea or a bad idea? And what are the side effects? In this video, I'm going to tell you everything you need to know about Ritalin so that you can make the best choice for your ADHD. Hey, I'm Nick McLaughlin, your friendly neighborhood ADHD coach with ADHD. Everything I'm about to tell you is what I've learned in this book right here from Professor Peter Hill, who is a doctor and an expert on ADHD medications. I'm not a doctor, I'm not telling you what to do. Ritalin is a stimulant. It's also the first thing that doctors are most likely to prescribe because it's a methylphenidate. Now, that's a big word. Don't leave the video. This is actually really important. You don't have to memorize the word, but memorize what this means. Methylphenidates usually are the first thing a doctor prescribes for ADHD because it's been tested and been around longer. There's more research on it. So the doctor feels pretty safe that this is a good option. Also, by the way, to be honest, quick disclaimer, I'm not really a fan of ADHD medication, but I'm well read on it, and I wanted to make sure that you knew what it was so that you could make the best decision for yourself. So just know I'm not pushing any of this on anyone. Ritalin's an immediate release medication, which means it usually lasts pretty short and it hits pretty fast. It lasts about 3 to 4 hours. And another interesting fact about it, it's used to treat narcolepsy. The effects occur an hour and a half after consuming. Higher doses do make it last longer. Ritalin wasn't really intended originally for ADHD, but it was actually intended as an antidepressant. Methylphenidates were also used for World War II soldiers that wanted to stay awake longer, so it would actually keep them alive longer. And Ritalin is the oldest known methylphenidate. It's the oldest known treatment for ADHD if you want to use it as treatment. There's a lot of research on it, so it's considered safe by the FDA. By the way, Ritalin is just a brand of a methylphenidate. So another reason it's important to know that name is because if one brand of methylphenidate doesn't work out, you can ask your doctor about another type of methylphenidate because they're pretty much the same thing, but a different brand. So think Nikes versus Adidas. They do pretty much the same thing, but one person's getting paid and the other person's not. That's really the difference. Because it's a stimulant, there usually are withdrawals at the end and you start getting kind of irritable and having a little bit of a crash. It doesn't really feel as nice as you would like it to without one. And just a heads up, usually 50% of children that are on stimulants do well with methylphenidates, and the other half do well more so with amphetamines. There's not really a way to know. Your doctor just has to experiment, and they'll always start off with methylphenidates first. I'm trying to say this in less of a scientific term so that you can pay attention, because I know I would be lost. But basically what it does is it affects the neurotransmitters, I'll say chemicals in our brain, right? Like dopamine. Everyone knows what dopamine is now. They've heard it. Dopamine and norepinephrine are the chemicals in our brains that affect pleasure, motivation, attention, memory, alertness, learning. So all these little chemicals that impact that are impacted by stimulants, because if you have ADHD, your brain isn't really getting it in the way it's supposed to. So stimulants basically make it so that you can get that connection that's kind of missing. They're usually best given during the day. They're not addictive. So if you've heard that they are, it's not true. They don't cause brain damage. If you're also taking Ritalin, it's really good to also take it while you're talking to a therapist, a psychiatrist, someone to help walk you along the way. So here's an important side effect you should know that is possible to have is it can affect the heart rate. So there have been known heart rate side effects. Stimulants usually increase your heart rate by a few beats per minute. So it's really important that if you have a child with ADHD that's looking to get Ritalin or any stimulant, that they should get their hearts tested as well to make sure that they don't have heart issues, because stimulants can affect that. The doctor will also try and find out if your child was born with any heart abnormalities, or if you had anyone in your family that's passed away from heart issues, if your kid has shortness of breath or faints. And all of this is basically to rule out if there's any heart issues in your child. And they're basically checking the blood pressure of your child this way as well. So if they're in the top 5 percentile of these issues, then they will most likely not prescribe stimulants. So those are the more common side effects. So if Ritalin sounds like it's for you, definitely talk to your doctor about it and definitely look to external support. If you need ADHD coaching and you want to get support on that, I have a link below where you can schedule a free consultation with me, and of course as well, along with other kinds of free downloads for productivity and answering any questions I can. And I'd love to hear your comments below if you have any questions about Ritalin, or if you've taken it and you have an experience you'd like to share. See you later, neighbors.